I practice in Arizona. I first heard about FMR actually from a few colleagues. So I was at another comprehensive dental course and two people came up and said, oh, you gotta go to this course. I said, why? What's so great about it? And they said there was so much distilled down into a few days with just really decades of expertise from Doc Dean distilled down into an intuitive workflow and fashion. So yeah, getting here and getting to see it has been awesome because they were absolutely right.
So I am a very young dentist, graduated last year and I'm now in my prosthodontic residency. And I joined the FMR team about 5 years ago during my D1 year here at NYU. And he showed me how to approach a class 3 case prosthetically rather than surgically driven. And my whole story of why I got into dentistry was because I had class 3 occlusion and I saw that I didn't have to go through surgery to get it fixed.
Went to dental school in my country, in Ecuador. I moved to New York and I went to NYU. I took a course and that's where I met Dr. Dean. I signed up for level 1. It just opened up my eyes to like a whole different way of practicing dentistry.
He makes everything simplified for dentists. These huge, big concepts that are really challenging. They are very challenging, but he made it so easy for even someone who's a D1, a D2, a D3 in dental school. They're able to approach these cases and look at them and really simplify it.
Oftentimes we graduate thinking, of course, that we know it all already. But when it comes down to treating your patients, there's going to be so many different scenarios. There were so many cases that I didn't know how to treat. I will sometimes dismiss the patient or even recommend patients to other doctors. But then after I did FMR, I'm thinking, I can do this.
He's got follow-up with his patients from like 2 decades plus, and his patients are still texting him photos, and he knows if something broke and what had to happen to fix it. I have not encountered that kind of follow-up in any other courses yet. Super valuable.
Everybody's very approachable. Everyone's super nice.
Everyone has each other's numbers. You can text them, you can ask them questions. We even have a huge group chat with all the graduates.
The ability that Dr. Dean has not only to teach, but also to attract so many people and the mentorship that comes with it, I feel like it's something that you just get here at FMR, where everyone has different experiences and we're always sharing those experiences just to improve ourselves.
Every single person from the staff, everybody's super friendly. And I think it speaks to the way that they treat their patients, establishing a personal connection, and you know that they are people who genuinely care and are looking out for your well-being as a practitioner, but also your future patient's well-being, making sure that you know the right recipe to get to an end result that's gonna look great, function great, patient's gonna love it. And as a practitioner, you're not worried about what you've done.
Occlusion is one of those philosophies in dentistry that never really got taught in dental school. They just don't have the time to get into it. And occlusion, the way people bite, is really the most important thing of any restoration, whether it's a single tooth, a bridge, a smile makeover, or implants. Making the teeth hit exactly at the 9-micron level is really paramount to make things last. In addition to understanding central relation, central occlusion, MIP position, and knowing the difference between each of those to get the teeth to hit exactly at the right time, exactly at the right position with every patient. This is the discipline of occlusion at FMR.